Hello, my name is Michael Savoldi. I'm a retired college professor in animal and veterinary sciences, California State Polytechnic University in Pomona, California. I was also the resident farrier for the W.K. Kellogg Arabian Horse Center, which is located on the Cal Poly campus, and that was for 30 years. Our topic today will be pathologies associated with the flat foot. One of my favorite sayings is pathology never lies. So let's start with this foot. It happens to be a left front foot. Now we're using a cadaver limb that was acquired at a rendering plant for educational purposes only. And so there will be some gross anatomy pictures involved. The question here is, what do you see? So I'll run through this quickly so we can start to look at these different items. First of all, we have wall length in the heel area collapsing. In other words, the hoof wall grows like a fingernail. When our fingernails get long, we will trim them down to a short or to the top of our finger. Well, the same thing happens in a horse's foot. When the wall grows, it gets long off of the sole plane, this being the sole plane. So anything beyond this point would be like a fingernail that's grown long, and we will call this length of wall. In this case, the heel area has grown long, but it is collapsing because it cannot bear the weight from descending from the body. And we need to be able to maintain control of this growth. Horses that are being shod every 5+ weeks, 5 weeks or beyond, really we have a hard time controlling this growth pattern. And when the wall collapses, then we start to pick up some very serious problems. The next thing we notice that the P3 bone is actually the pedal bone or the third phalanx within the foot, has many names, coffin bone, but it is pushing the sole downward. Remember that the horse stands on its skeleton. Everything else surrounds the skeleton to protect it and to do functions like movement and things like that. So the sole is weight bearing. The bars are constantly weight bearing. And when the foot starts to weaken or get out of control, the bone can press down into the sole body, causing some damages. The next thing we will notice is that there's an angle change to the bar. Now, what's interesting about bars is they control a lot of the heel width. Heels that are wide in a horse's foot usually have bars that are crushed down a little bit and have a lower angle. Heels that are narrow on a horse's foot usually have straighter bars, and that pulls the heel inward towards or closer to the bone. Both angles of those bars, the sharp straight angle or the collapsing low angle, have detrimental effects on the horse's foot internally. And we can see the sole collapsing in the midsection. All of this I will explain through this lecture, and we will try to bring clarity to these. And then the bar here, we see a bar fracture developing. So the bar is a continuation of the hoof wall. So as the hoof wall grows, so does the bar. And it can get out of control. And so we need to learn how to control and maintain a healthy bar. And then we have a deep stress fracture in the sole body. Now this is I'm going to spend some detail in this area because it's hard to tell what I'm talking about here. But this deep area is in stress right through these cracks. If you notice, the sole has all these little cracks. Well, this portion of the sole is dry. And so when the body weight stands on top of the sole will flex outward. And then when the body weight releases, the sole will flex back. When the horse is standing, the sole will be stable. But all of these cracks are a product of the flexation of the sole. And we can see that there's different layers because the sole is in layers. So we can see layers here, we can see here's another layer. So all of these layers can be taken down to a single tissue plane. And we will show that in the next slide. So here we see a foot that has been trimmed to the sole plane. That simply means taking length of wall away, like trimming your fingernail. Just trim it down, get it cleaned up and out of the way of stresses. And this is what this represents. Trimming to the sole plane is simply removing length of wall beyond the sole plane. So let's start going through this foot. Oh, before I start, look closely at this tissue. See, this foot can be trimmed to the sole plane, but in this case, this foot is not ready or has not adapted itself yet to stand on solid ground. This foot might do all right on grass, or it might do all right on soft tissue, but it wouldn't do all right on hard ground or a horse that's moving on hard ground because it needs a little more protection. Remember that it takes 3 or 4 trims to get the foot climatized to the area it's going to be working in. So let's continue. So what have we done? We've removed length of wall in the heel area. If you look here, we have a long heel that's collapsing. Also, if you look at the frog wall junction here and here, you can see that this heel is actually longer than this heel. So that alters the plane of the capsule. This long heel can put stress opposite the heel on the toe. In this foot, we're seeing a lot of stress through here. So keep in mind that although we've been trimmed to the sole plane, we have to prepare the foot properly to be able to stand on that foot trimmed to the sole plane. And this foot needs time to adjust. The next thing we'll look at is shearing to the white line. How does this occur? Well, when you set in a hammock, what happens to the ropes? The hammock sags and the ropes get tight. The same thing when the bone is pushing into the sole body, wants to pull the white line away from the wall. And that way we can have a shearing effect taking place. Another thing that we really don't want to see is the rounding, is this area here. You can see little red marks here. That's a sign that the bone is loading the dermis, and the dermis is leaking a little bit and staining tissue. But the main point here is learn to recognize this. Because if you look at the white line in this area, you can see that the white line is on the same plane as the sole plane. But on this side, the white line is below the sole plane. That is because the sole is pushing outward. It's prolapsing, and it's starting to round up on these edges here. You see a roundness occurring to the sole. That roundness means that it will wrap around the P3 bone and cause inflammation to the P3 bone. And when the P3 bone is inflamed, we pick up a problem called pilostitis. So this is an area that you want to concentrate hard on your horse's feet and try to prevent this from happening. Then we've talked about the angle change to the bar. That simply means that the commissures are getting shallower. The commissure would be this area coming up through here and here. And when you trim and identify the problems in the foot, you can also see that this horse does not have deep commissures. They're rather shallow. So as the commissure lowers, so does the hairline on the outside of the wall, and then the vertical depth of the wall gets a little less. Another thing that you see with shallow commissures is that they will widen the heel. The angle change will widen the heel. So we want to learn how to maintain the depth of the commissure to prevent it from loading or prevent it from shallowing. If this bar was straight, had a straighter angle, then the commissures would be deeper, the heels would be narrower, and the sidewall of this horse's foot would be more upright or straighter. This is the area I'm talking about right here, shallow commissures. Then here's stress, the sole collapsing in the midsection. We will cover that in a few minutes. We have a stress fracture in the bar. Now, if we look at, we mentioned how we can eliminate, how we can clean through these layers carefully, and we could come to a single tissue plane. Well, these cracks on the sole here, on the dry sole, they will generally end on the epidermal sole. This is the epidermal sole of a horse's foot. It's like skin covering the material within. But when the cracks, if I were to try to clean this crack deeper, that means that I'm going below the sole, the epidermal sole area, and I'll be digging a hole or a pocket, and I'll also be thinning the sole. In this area, we see a deep stress fracture. Now, unfortunately, when I was working on this foot, I cleaned quite a bit of the material away because I was investigating this. And personally, I wish I would have left some more tissue here so you could identify a deeper stress into the sole. See, for me to go any deeper, I'm going to have to thin the sole. But that's a sign that there's maybe more problems taking place within the foot. And then we see internal loading from the P3. That's a bruise coming from the internal load of the P3 bone onto the dermis. And then another thing is we see tissue shearing in the toe. So these are just a few things we could notice on this foot. Now, I would like to say that all feet are different. And so the problems you will see in this foot relate strictly to this foot. But there will be patterns to these problems that can be associated with other feet. One thing I say about all feet are different is the way I could explain that is if you were to buy, I should say those of you that are fortunate enough to be able to buy new shoes, and you put them on, have you noticed that one shoe is, or one foot is looser in your shoe than the other? Well, that's a sign that your feet aren't matched. And that's the same with horses. Horses' feet are not matched. So we should be careful when we try to match them because we can offset something internally and cause damages. Every foot should be treated independently. You evaluate the foot for what it is. It's morphology, because morphology is the study of shape. And so you have to really look carefully at the foot, wonder why it's doing what it's doing, and then treat it independently because the other foot may not be doing that at all. A good example is in what we call a horse with high-low heels. So this is our foot before trim. It is a left front foot, meaning that the straight side is the lateral side, and this side with the severe bend taking place is the medial side. This is actually opposite of most horses, but this is the way this foot is, and that's how it developed. You notice that the hairline is lower on this side than this side. So I would say, just by these little details, I would say that most likely the depth of the bars are not equal. The depth of the bar on this side is less than the depth of the bar on this side. In other words, this side would have more vertical depth in the commissure area than the medial side, because that's generally what tells me what's happening here. Also, the P3 bone may not be, and I doubt if it is, a horizontally plane P3 bone. It's going to be lower on this side because the commissure depth is lower on this side. Getting carried away, really. And here's the what the P3 bone looks like inside this foot. This is not a healthy or functional P3 bone. Look how rough the distal border is. Look how much cortical bone is missing in the toe. If we look at a lateral view, we can see the same thing taking place. This is before trim. And this is the bone that looks to the same bone on the lateral side. And as you can see, this is not a healthy bone. It is demineralizing. We will spend more time on this. So let's look at before and after trim. Well, I'm going to use a trim called the sole plane, trimming to the sole plane. That will horizontally plane the capsule. It does not address the plane of the P3 bone. It only addresses the plane of the hoof capsule. And there's this term we use called uniform sole thickness, or UST. And I will explain that in a second. So when we remove the distal border of this hoof capsule, we've now exposed the internal structures just within the capsule, just inside the capsule. And we can say, here's our sole. This is our sole plane. And we can see that it's fairly uniform in its vertical depth. It happens to be a thin sole. This sole is thinner than normal, but remember that it's a flat foot. And so that can compromise circulation within the dermis of the sole, which can alter the vertical depth of the sole. This is the sole, the edge of the sole, because the white line has been removed from it. There's ways of identifying white line in the sole. And we can see again that it is vertical. It is fairly, the picture shows us it's very vertical or very uniform in its thickness. But in reality, if you define it, if you go in and look close, it will vary a little bit. But it is a very handy guide to use, for at least for my research, because everyone in the world can duplicate my research if they understand how I'm trimming a foot. You know, that's something to be said about equine research. It's impossible for me to duplicate anyone's work unless I know exactly how the foot's trimmed. Then I can duplicate it. So here's our vertical depth of the sole border, which verifies the plane of the hoof capsule. In this case, what do I mean by horizontally planed hoof capsule? A horizon, your floor is on a horizontal plane. At least I hope it is. You spill the water on that, it's going to run to the low side. And same in the horse's foot. If I were to pour a little bit of water in the foot on the left, it's going to settle in the low spots, and that's where I'll find pathologies or foot damage. We can remove the hoof wall because it is a necropsied horse or a limb. And now we can start to look at what's going on inside. So here we have the coronary cushion, we have sensitive lamina, and then our sole. Now what I'd like to say about this, the word sensitive means that this tissue is sensitive. It has nerve endings, it has vasculatures. Vasculatures means that it has arteries and veins. So, and it's delicate. When you look at this outside hoof here, there's no big deal. It's tough looking and you can do what you want with it. Trim it any way you want. Let the horse run on it. But when you remove the capsule and look inside, you realize how delicate this foot really is and how important a trimming technique can be to a horse's foot. A poor trimming technique can make a horse sore in its foot. If the farrier is constantly trimming that foot all the time and the horse is and making the horse sore, that horse isn't going to pick its foot up for the farrier. It may not even want the farrier to catch the horse when it's in a stall. Horses know how to talk to us and say, ouch, this guy hurts my feet. Unfortunately, the next farrier that goes to trim that foot, the horse will relate pain with pain and not want to give the farrier a foot. So that farrier's work becomes much harder. So those are just things to keep in mind about what pain can do to the memory in a horse's head or mind. Okay, and if you notice, we don't have uniformity here. So this hairline is low, but so is everything else within the foot. There's low vertical depth here. There seems to be a little bit swelling going on here, so we have more vertical depth here. The medial or the lateral side, fairly good, looks well. But if I were to try to horizontally plane the hairline, I'm going to have to leave more wall length on the bottom. I'll have to, let me say, off trim the foot, trim away from the sole plane. And that means that I have to leave more wall in this area in order to tilt the foot and lift the hairline. That is a negative thing. That's a positive thing if you're into symmetrics. If you like a foot to look very symmetrical and look good, well, you can do that. The farrier can do that with his tools. But what does that mean to the inside of the foot? It could cause a lot of damage inside the foot. When we accept the foot for what it is, we have to learn to work with that particular foot. And just try to help it. That's all we can do. And then after I remove the soft tissue, now we can see our P3 bone is right here. We have ungual cartilages that are up here above this area, and then our sole. And if you notice, there's a horizontal plane. I'm going to talk about this. This sole plane is not a level sole plane. Look closely. This is lifting off the ground. Look closely here. The P3 bone is moving down below, wanting to be below the proximal border of the white line. That's when damages occur. So we will cover that, I think, coming soon. Here's the sole body. And if you look, you can see now that it has a flat toe arch because body weight is standing on it. Look where the white is. Look at all of the white. That means that this is all weight bearing. Here we have red here, so we have some circulation, but all this white is weight bearing. So we have to be aware of that. Also, if you notice that the vertical depth of the bars are not the same, this is taller than this one. And look at where our damage is. We're losing here. We have a bit of an arch into the sole body here, and here our arch is collapsing. And when bone pushes down here and you have length of wall beyond the sole plane, then that can leverage this in an upward direction. And this is an example now. The bone shows the bone right on the top of the sole. In reality, there's tissue there holding the bone a little higher up. But this makes the point that we have very poor bone elevation. The bone is just getting too low. It's starting to compromise soft tissue within the foot. And now we get a good example of how this being forced to bend upward, then we can see that the sole is now starting to wrap around the bone, causing bone damage. We can go advance a little further. Let's take a look at our good arch here. We have fairly decent depth to our commissures. And now look at this arch. We have more vertical depth here than we have here. That means that the bone will be in a bit of a roll position within the capsule to this side. And we can see that the damage to the top of the sole here is increasing. Oh, I better get my cursor going. But that's what I mean. Here's our deeper commissure or shallow commissure. And you can see that there's more damage on this side than this side. And we see more damage occurring here. This side's not sinking down or dropping down as much as this side is. We have quite a bit of damage here. So if we were to radiograph this foot, it would show low bone elevation, and it would show most likely in a slight roll to the medial side. It'll be listing or rolling to the medial side of the foot. Here's our flat toe arch would be A. It just is flat, and you would like to see more arch into A here, into here. You would like to see more arch developing up here, and a collapse bar is coming down and collapsing. And then descending medial arch. When we place the bone onto the top of this sole, we now can begin to see the damage that's occurring. This bone now is in a medial roll, so it would not X-ray, it would not radiograph horizontally planed with the hoof capsule. Left front lateral view. So this is just the foot before we did anything, just cleaned it up a little bit. I'm talking about low P3 bone elevation. This is after trim to the sole plane. I'm going to remove, oh, and also you notice there's an abscess breaking out up there. That was on the foot when we got it. And then here's our abscess. We've trimmed to the sole plane, and we can see that this is not a level trim. The hoof capsule is not level. If we look here, The sole plane is fairly level, except into here it's a little bit up, coming up. Um, this is a little deceiving, but it's doing this to the foot. But if you notice on here, here's where you need to have more knowledge of what you're looking at. If we look at here, the wall isn't touching the ground, and yet our sole plane is touching the ground. What's going on here? Rasping. When this foot was rasped, the rasp had a little bit of an angle to it, and so it lifted the outside of the wall off the ground a little bit. So it could be deceiving that you have a bend here. We know there's a slight bend in the toe. I'll show you that in a minute. But in reality, it has a fairly decent sole plane in the toe area. Horizontally planed hoof capsule. So now we have the ability to compare. This is our foot after trim. This is here we see our coronary cushion, our sensitive lamina, and the soft tissue that's involved. We can remove the soft tissue, and now we can see very low bone elevation. And the thing I want you to look at is carefully is this right here. When the bone sinks into this area here, the distal border of the sensitive lamina can scar. And when it scars, this area can actually increase, the sole connection wall can actually increase in its vertical depth, but the sensitive lamina will decrease. Well, that's not really happening here. I just wanted to mention that there's differences in these feet that we need to be aware of. What's happening here is this sole is rounding around the bone, and so it's lifting it in this area. So we just mentioned two different ways of evaluating the sole plane for its vertical depth. And that's the bone. So look closely at the stress that's taking place in this bone. It's all demineralizing through this area. Look at our stress here, it's demineralizing. Why is this shaping like this? Is because of this curvature here. As the sole bends up, we start to put more stress on bone, and we start to demineralize bone. That is not a healthy bone. We can look at the P3 bone and the sole. Let's look again up here on the top, and we can see a horizontally plane sole plane. I'm not sole plane, but top line of the arch. It's a good arch. Very hard to find in feet because traditional horseshoeing does not address how to maintain the arch in a horse's foot. And that's critical when it comes to internal health. So let's look at the collapse in the arch in the toe area, and we have a weak heel arch. All of this is failing. Our top line of our arch is even failing, coming down through here, this area. It's not like this. It's all getting crushed down into this area, which will lower the bone position in the capsule and put less elevation to the bone as it gets closer to the sides of the foot. Here's the bone on this foot, and it's just poor bone elevation. Here's the palmar process is falling between the bars. This is something very important to realize, because you can have a bone falling between the bars and still have some depth to the commissures. But sometimes the bar itself will crush and lower, and then the bone will lower. But it doesn't have to be this low because it's still holding an edge. It's still holding some distance away from the sole body. So here's a good bone elevation. And I keep forgetting my cursor. But here is good elevation to our bone. You notice we have a horizontally planed top line. We have a horizontally planed P3 bone within a horizontally planed hoof capsule. This is something that has to be developed because we have to counter the effects of body weight. Controlling and maintaining a foot in order for it to function well takes a lot of work. You can't do it every 5 weeks and beyond. Sometimes these horses have to be shod every 3 and 4 weeks, depending on the load, how heavy the horse is, and the workloads, how active is the horse. All of these things require maintenance and a lot of control to maintain a foot to function well. And then, of course, here's our flat heel arches collapsing. P3 bone on the sole. We've cut the sole in half. Don't worry about this mark here because that's a hole I drill. But I want you to look at the flat toe arch. Look closely here at how this is lifting up a little bit. This is naturally occurring because we have not learned how to control bone position. Modern farrier science is leading us in that direction. At least I hope it is. And then when we place the bone on top of the sole, we can see that this bone has a little bit of an upward curve to it. That's because the sole plane has this curve starting right about here, going up here. When the bone pushes down and you have length of wall and not dealing with the arch, all of this action takes place, which affects the bone. Now, another thing I'd like to talk about, well, here we say bone modeling to the angles of the sole. The angles of the sole represent the arch, or we also say sole modeling to the angles of the bone. Very interesting to know and understand both of those concepts. You see, the sole can change rapidly. Just change shoers and you can put different information into how the sole is going to warp around or bend. And so it takes a while for bone to change. So if the sole changes, that's the first movement. And then the bone, because bone models the pressure, Wolff's law, that bone will start to accept the modeling that's being placed upon it from the sole. But there's another statement here that says sole modeling to the angles of the bone. Well, if you try to restructure feet, you can spend up, look, I'm raising up, I'm getting excited here, getting close to the camera. But here we see a bone that has a bone arch in it. The arch is good in this bone. I'm not sure if you can see it very well, but it has a decent arch. So if I'm trying to remodel a foot and maybe and some time passes and you start, this foot is turned around to what we're really trying to achieve, fine. You may want to take the orthotic out. Well, if they don't alter the plane, alter the body weight or the exercises, it most likely will go flat again. But let's say they change their idea of how much stress they want to put on the foot through exercise, then your arch may hold and may stay maintained. But I've worked on horses that have taken up to a year to get the foot back to looking to stable, to functional. But when we would take the orthotic out, in 3 days, that sole is flat again. The foot's starting to widen out again. So the question is, why? We always should ask why. So here we see a bone. It's a very young bone that's still got a lot of growth and development to do, but it's a very flat arch, bone arch here. So when you're working with an aged horse that's lost its edge, because pedal osteitis will inflame bone with inflammation to bone, and then bone will reabsorb and disappear. So it'll get shorter and shorter, but it also gets flatter. So if you have a bone that's a flat surface here, has lost its arch to the bone, and you take your orthotic out on that horse and then let the horse go, and that foot goes flat, the majority of the time it will be a P3 bone that has lost its bone arch. So there you can use an orthotic to maintain the capsule to keep it functioning well, but it's also will be a band-aid for the bone, because once you take it out, that sole will go flat again. That's just some handy information to know, to understand. And then we have here the sole body that you see with the bone removed. And you can see the collapse in the midsection. And we can see the descending medial arches flattening out and starting to roll up, lift up here on our roll. That's that. When you look at the bottom of the foot, that's what you see rolling around, that first discussion we had. Looking over the top of the foot, looking at pathology. So when I place this bone on the foot, those holes I drilled, there's other uses to them. And so what we can do with we can put a drift pin in the hole and then put a drift pin into the bone. And then when we set the bone onto the foot, you kind of get an idea of its position within the capsule. And this is because the foot's flat, this space is widening moving away from the bone. If this horse had a very deep arch, this space would be closed up. It would be very close to the bone. So the sole migrates either to the bone or away from the bone according to the arch within the foot. We have, oh, excuse me, I lost my cursor there. Keep this cursor, you have to always engage and disengage, and I forget to do it quite often. But this is what I'm talking about. You see the space that's going through here. Flat-soled horses have a larger space. Now, there's no absolutes, so just keep that in mind. I'm talking about patterns that we see. But generally, a flat-soled horse will have a larger space here. But a deep-arched horse, a deep arch, will have a narrower space here. Too deep of an arch can compromise the bone in the heel area quite drastically, because now the wall's very close to the bone, and the bone now is feeling the stress from that closeness, that pressure onto the dermis of the bone, and then it'll affect the bone. Too large of a space here can have a negative effect on bone, because now all of this tissue is under tension and it can roughen bone. Sometimes people try to force a heel out with like a Chadwick spring or whatever method they have, put a pin in the toe here so the heels will move in and out. Well, remember that if you force this heel to go beyond its maximum when it comes to soft tissue, you're going to have tension on soft tissue and damage both tissue and bone. So there's an optimal space in this foot. And if you start to study horses that have decent feet with decent arches, then you can start to visualize what is a decent space for soft tissue. And then also we can see the effects of loading, of body weight on the sole, that we're picking up hot spots. But a very interesting on this particular horse, remember, all feet are different, but we see a prominence developing right here. This is a prominence developing. It's building into a hard spot. And then looking at the damage to the midsection, this is looking at the top of the sole. All of this white is weight bearing, shows weight bearing, and the you have to visualize this foot, the lateral view of this foot. Remember, it was a little steep here, and then it came down gradually. And as the bone goes into a positive palmar angle, we start to load more space of the sole here. More of this will be loaded. And then if we were to look at, oh, there's our prominence that we will be talking about in a few. And then this is the sole dermis, and you can see the damages that are occurring from load, not only to the top of the sole body, but also to the dermis in this area here. Remember that this area is on the bottom of the foot, would be an area where the veterinarian would put his testers to check for soreness. The horse may flinch, and it generally gets labeled navicular disease or navicular syndrome. Well, a lot of the times the navicular bone isn't really, there's 4 sides to the navicular bone, and all sides have problems, and each problem has a different area to discuss, but I'm getting off subject. So let's just realize that in a lot of the cases, when the veterinarian tests this area from the bottom of the foot and the horse jerks, it may just be collapsed nerves, sensory nerves in this area that are sending signals to the brain. And then this is what here's where our nerves would be over in this side here. That's just showing the collapse in the midsection. And then go back to our stress spot. Can you see how it's buckled? It's a little buckled spot. The way I view this is, if you have a box on a carpet and you push it forward, the carpet will buckle in front of the box. Well, you could look at this foot, at the dermis, as a carpet, and the bone as the box, because the bone's constantly moving. So if we're causing an unequal heel this could be a good example of a more of a heel, length of wall in the heel on this side of the foot than this side, because the bone now is going to most likely want to shift or move in this direction. Heel length is critical in a trimming technique. I've evaluated just about every trimming technique there is. Like, we could say maybe the 50-50 trim, which is very popular, but it doesn't address heel length. It can offset a capsule one way or another. So, like I said, I say about trimming techniques, you can focus so much on trying to on a trimming technique that you lose sight of what's important, and that's what's that soft tissue within the foot. So here's, like I say, here's that stress spot right here. The tissue's buckling and it's starting to get hard. So we can look now at, remember I told you the stress fractures on the sole. This one I had to dig a little deeper, which I wish I hadn't, because it would have shown this area a little clearer. I tried to clean that, go deeper to see where the bottom of the crack was, and I started thinning the sole here, so I quit doing it. Oops. I started cleaning this area out to find where the crack bottomed out, and I noticed the sole was getting thin, so I was going too deep, so I quit. I should have left it, then you would have seen a much stronger crack in this area. And this is a bump on the top of the sole, stress bump. And then if we go a little further, it will align with this stress fracture in bone right here. So all of these little signs on the hoof capsule or on the sole all have ideas. Now don't get me wrong, not every one of these stress bumps is going to show a crack in the sole. This one happens to be developing a crack in the bone in the sole area, in the toe area of the bone. And then this is just a closer look at the stress bump. There, that's the top picture is the sole, and the bottom picture, I just can't get used to this cursor, but the bottom picture is the dermis. So here we see a stress bump developing here and the dermis developing here. There's an interesting question that a lot of the veterinarians and researchers are going to have to ask themselves. Look closely at those two. There's a very interesting thing taking place. And then this is the effect of the stress bump on it's creating a cavity within the sole. So these are just a few things that occur within the foot that we need to be aware of. So like I said in previous talks, if a foot's not landing flat, the farrier may say, oh, I can fix that, and off trim the foot so it lands flat. But here's an excellent reason why the foot may not be landing flat, because this could be pain. It's like having a rock in your shoe. The horse is going to alter its stride to land so it's comfortable. So don't misread this stuff. Pay attention. Horses don't have a problem with the way their feet move if they're feeling good. So there's usually a reason why a foot's not landing flat. Now let's look at bone pathology. So this is the toe of the bone. We can see here all of this rough edges. This is all demineralizing bone, and it's a product of pedal osteitis. Here's a bone that has pedal. I wish I could hold it to the light because you can see right through this bone here. But look at this portion, if I can get it focused. I have to sit up again. You see, all that's a sign of pedal osteitis. You can see this on a radiograph. And you can see how thin it's making the bone and how the bone is wanting to bend out a little bit because it's up in a positive palmar angle. Maybe just in this particular foot, it's a very slight positive palmar angle, but it's enough to cause this pedal osteitis in the toe and for this to happen. And then if you remember, we pointed out the area where the sole is starting to wrap around that bone. That also helps develop that. Also notice that here we have some cortical bone covering. Here we have lost the cortical bone. It's missing. So are we developing into osteoporosis? I'll leave that for researchers that have the ability to study osteoporosis in the P3 bone. I would like to know that answer. I'm going on what it looks like, but I'm not going on detail because I don't have the facility to really go into this type of detail. Again, I will be happy to help anyone with research. I won't be able to help you with what you're looking at there. It may be on my pay grade, but I can cut your learning curve. I can shorten that learning curve immensely. You know, I have over 50 years of knowledge looking inside of feet. So I want to help if I can. It's all for the benefit of the horse. And then we looked at the missing bone and the cartilages and bone. This is all stress related. Pelosteitis taking place. Could this be, I'll go back to whoever would like to do research, could this be called osteopenia because it looks like osteopenia? We need to verify it and get it straightened out. So we could say that this bone would have pelosteitis, osteoporosis, and osteopenia. Again, I'm just going on observation because I do not have the detailed equipment to go into this area. Please, someone do this. The horse needs you to verify these things. I don't need you. I'm interested. It's the horse that needs you. And then looking at the stress fracture on the bone, we've talked about this a little bit, and then the cavity that can be put. So this 1 foot, flat foot, shows all of this. But keep in mind, this is just 1 foot. I would not expect to see this in every flat-footed horse. It just happens to be the morphology and the damage taking place of this one particular flat-footed horse. The purpose of this lecture is to bring an awareness that all of this is going on. Here we see staining of tissue. This is a good little bit of information. So stress in the distal border of the sensitive lamina will produce different colors in the sole and white line. So first you may start to see the first stage is a light yellow. Then it becomes into a dark yellow. The next color will be red, and the final color may be black. So there's actually a white color in there. One time I tried to, apparently the sole doesn't have tubules. A veterinarian friend of mine in Italy explained to me that those are sockets. Well, I understand sockets because if a socket starts to get into dry material, it's going to shrink up and look like a tubule. I've had an experience. I don't know how my time is, but I've had an experience with a horse. I knew the summer foot quite well, and it came winter, and I just trimmed the toe like a summer foot, and I had all these little red dark spots. What happened? The winter foot got wet. The sockets increased in their vertical depth because the dryness wasn't shutting it down, and I tipped off the tips of the socket. I didn't make that mistake again, but it was fine. No problem with the horse. It didn't really bleed. It just a little drop of blood was there. So the sockets do migrate. Wet feet, the sockets can be longer. Dry feet, they can be shorter. But so I tried to track up a single socket from the bottom all the way up the sole. And that's where I found all these different colors. The white color is just like necrotic tissue inside that socket. So that would be the first thing you would see, and I just left it out. Now, let's do a review. This is your homework. I'm passing this all out to you for your homework. So let's look at this and see how much you can remember. Look at all of these bruises. There's a reason for these cracks here and here and here, and all these bruises have a meaning. Remember that here we see our white line is even with the sole plane. Our white line is below the sole plane, and we see rounding taking place to our sole here. We see dark yellow tissue in the white line here, meaning a heel's under stress. We see it all the way around here. coming around. We see red, that's stress to the dermis, and it's seeping. Vessels will seep if they're under stress. So let's put some words to this. So we've controlled the heel by simply increased our trimming schedule. We're trying to get it down so the horse can maintain. You know, the more often a horse is trimmed, the less vet bills you will have. The more often the horse is trimmed, the less you'll be blaming the farrier for a lameness that's actually occurring through exercise, not the farrier, but through over-exercising and body weight. Trimming techniques can cause soreness, but primarily the lameness is coming from within. And the easiest option we have is to blame the veterinarian. Veterinarians get blamed too, but the easiest way out for the trainers and owners is to blame the farrier. Why don't you take some responsibility and think about too much body weight, both horse and rider, too much exercise. Trainers are noted for way overworking the horse, especially a week before the show, and then they wonder why the horse is lame the day before they have to show. It's not fair to ask the farrier to do something for that foot, because it's not fair for the horse to have some temporary thing put on so a person can show the horse. As you can see, this is a sore spot for me because I care a lot about horses. Here we have sheared white line and P3 pushing into the sole, causing it to wrap around bone. Angle changes in the bar. We also see, what do we see here? This is just showing that there's corrosion in the midsection, stress fracture to the bar. This stress fracture to the bar could eventually develop into a bar abscess. And then we have a deep stress fracture in the sole body and internal loading of the P3 bone. So look carefully at all, and shearing to the tissue in the toe. So look carefully at this and memorize it. This will greatly help your horse, help your knowledge in able to treat the horse's foot with more respect and proper shoeing intervals. And then let's look at the top of the foot. We have up here in the corner the sole, the bottom of the sole, distal border of the sole. This is the proximal border of the sole. Again, let me kind of repeat proximal and distal. If you proximal is furthest away from the body, in other words, and proximal is closest to the body. In other words, we could say my hand is distal of my shoulder because it's further away from my shoulder, or we can say my shoulder is proximal from my hand because my shoulder is further away from that area. So here we have shearing to the white line, angle change in the arch, P3 pushing into the sole body. We have a deep stress in the body there. It also sheared to the white line, internal loading of P3, sole collapsing in the midsection. And again, what can you see the P3? Let's close now. Okay, I've given you all these markers, all these little clues. Now can you see the P3 bone? Look closely to see if you can see areas of the P3 bone, because where are those red spots? They're being loaded from body weight, which is on the bone. The majority of them are. So I'll show you the P3 bone. They all align with all marks. So I hope that you enjoyed this. I was going a little fast on this lecture, but I'm trying to keep within a decent amount of time. And so again, I've got a few ideas after looking at building this lecture that to where I can do others to define more of the foot. I really hope that lectures like this stimulate research, stimulate people to do research. The horse desperately needs it. For hundreds and hundreds of years, we've been looking at the outside of the foot. And personally, I'd like to see us move into more of a modern farrier science to where we can start looking at what's making this horse sore. It's not the outside of the foot. Well, it's the movements that take place within the capsule that's damaging the internal structures where the nerve endings are and the vasculatures are. The foot's very fragile and it's delicate, and it needs to be treated with respect. So thank you again.